Assalamu alaikum guys. In this video we are talking about the examination of oculomotor, trochlear and abducent nerves, the ocular nerves. So let's start the video. In this video I will tell you about the extraocular muscles along with their functions and nerve supply, the pathway of the light and accommodation reflex. Examine the functions of oculomotor, trochlear and abducent nerves, ocular nystagmus and diplopia, and the causes and the features of oculomotor, trochlear and abducent nerves. Anatomy. The size of the pupil depend on a balance of parasympathetic and sympathetic innervations. The parasympathetic innervations of the eye is supplied by the anterior vestibule nucleus of the third nerve. Stimulation of these fibers causes the pupillary constriction called miosis. The sympathetic innervation to the eye, the stimulation caused the papillary dilation. Mydriasis is as follows. Fibers from the hypothalamus go to the ciliospinal center in the spinal cord at 6C8, T1 and T2, where they synapse the second order neurons, exit via the anterior ramus in the thoracic trunk and synapse in the superior cervical ganglion in neck. Third order neurons travel from here with the internal carotid artery to the eye. The additional pupillary reflexes depend for their afferent limb on the optic nerve. Constriction of the pupil in response to light is relayed by the optic nerve and track to superior colliculus and then to the anterior vestibule nucleus of the third nerve in the midbrain. Afferent motor fibers from the oculomotor nucleus travel in the wall of the cavernous sinus, where they are in the association with the fourth ophthalmic division of the fifth and sixth cranial nerve. These nerves leave the skull together through the superior orbital fissure. The egidoconstrictor fibers terminate the ciliary ganglion, whereas the postganglionic fibers arise to innervate the iris. The rest of the third nerve supplies all the ocular muscles except the superior oblique fourth nerve and lateral rectus sixth nerve muscles. The third also supplies the levator palpebrae superiorus, which elevate the eyelid. Then we are talking about mechanism of accommodation. The accommodation is the mechanism that focuses the lens system of the eye. The accommodation results from the contraction or relaxation of the eye ciliary muscle. The ciliary muscle is circular ring of smooth muscle attached to the lens by suspensory ligament. Contraction causes the increased refractive power of lens and relaxation causing decreased power. Then we are talking about accommodation for near vision and accommodation for far vision. Accommodation for near vision: when the eyes focus on near vision, the ciliary muscle contracts and circumference decrease and suspensory ligaments become slack, and these are not pulling on the lens and become more rounded. Thank you so much for watching.